Yeah.
Which makes him a perfect neighbor.
There you go.
It is a brave thing for a surgeon to operate on their next door neighbor, because that is a nasty Christmas card.
The not sleeping at night, the waking up every time you roll over, he was fine with.
I've got another shoulder.
It's
I
the
can sleep on.
backswing, yeah.
Yeah.
Testing the boundaries a little bit is the real way to advance the science, right?
Yeah.
If no one steps out, everyone's still doing it the same way forever. Welcome to the Zero Downside Podcast with Dr. Wade McKenna, sponsored by MoabTexas.com.
Welcome to another episode of the Zero Downside, guys. Today is a special one because we've got a very special guest. One of my personal favorite patients, because he is always coming in with something new, whether that be diving into the pool and re-injuring the shoulder that Dr. McKenna fixed, or, just bringing a smile to everyone. So I'm really excited to have him on today. And I'm going to let everyone kind of introduce himself as Andrew. If you want to introduce yourself, please go ahead.
Andrew White, also neighbor to my favorite doctor, Dr. McKenna. Been there for about 2 years now. I'm in construction and I do consulting. And
he's a broken mess.
yeah,
Which makes him a perfect neighbor.
there you go. Yes. Former football player and weightlifter, so
Yeah.
everything's broken.
A kicker,
let's
kicker,
take
which
a second.
kickers, we always laughed that we said offensive linemen are usually the smartest guy on the team. Really, that's because we didn't count the kicker, because the kicker kind of showed up, the coaches were even afraid to talk to you because they didn't want to mess up your juju. Like, a coach can't be mad at a kicker because if they mess him up, so they just everyone like the kicker, you just like pretend like he's in his head and the coaches will walk around him, but they just kind of hang out, kick some balls and have girls shag balls for him, and are having very rarely even participated in the post practice runs for it.
No, we would roll a barbecue grill out there.
Nice.
I want you to know your role on the football team was very important.
Oh, for
So
sure.
We've already
Yeah.
started out on it.
Yeah, I didn't have 30 or 40 plays to be good. I had one or two.
Yeah, you
So
had to shine in that moment.
Absolutely.
Well, so I do want to start off very quickly. It is a brave thing for a surgeon to operate on their next door neighbor, because that is a nasty Christmas card. If that doesn't go well, right? Like that's not somebody that you can hide behind the desk and
No.
evade, checking the mail, they're eyeballing you. So everything has gone well, right? Before we get into
Absolutely.
Okay, that's good. That's a healthy start to the episode.
For sure, Andrew. So I've lived in this neighborhood for more than a decade. I don't know one except for patients. Like, there's people in our neighborhood that I've taken care of and operated on. I had no idea they were my neighbors. And Andrew moved in, and Mr. Network, he's telling me about all the people moving in and out and who lives there, and they have to get, oh, did you know they have a kid? I'm like, dude, I know the neighbor on one side and now you're on the other. So now I know you. Those are the two people in the neighborhood I know. I leave before everyone else gets up. I come home when everyone else is asleep. I most, if I don't have my kids, if I don't have tests now, so my 10-year-old is my only roommate left at this point from the daughter standpoint. One has her own place in Fort Worth Law School, and the other's at Oklahoma State as a senior this year. Go Pokes. So it's just me and a 10-year-old most times. So when Tess is there, we use the rest of the house. When I'm there, I come in at night through the back door. My bedroom's right there. I don't even see the front of my house. And Andrew's like, hey, I'll lift a note on your front door. I'm like, dude, I haven't been to the front door in 2 weeks. I don't know who, unless DoorDash is delivering something, I don't go to the front part of my house.
And your coffee every morning.
Yeah. But Andrew is Mr. He knows everybody. And so he hit me up pretty quick. We're talking early about a shoulder, because he had already had one shoulder operated on and had not done that great. And it took a long time. I think you said that it was like a 2-year recovery or something.
I was 28 years old and I thought it would recover quickly, and it did not.
Yeah. Well, because we've talked about this a lot now. What's published on rotator cuff surgery is a 30% failure rate, unless you use cells. So with bone marrow, failure rate 6 months 0. Without cells, failure rate 6 months,
Right.
30%. And Andrew went through that, prolonged recovery, adhesions, worked on strength and range of motion. So he was now not being 28. When he injured this shoulder, he had been putting it off for a while because Andrew, unlike some of the older guys in this room, has more time, and golf is much more important to him. than me. A lot of when you're a business consultant, a construction guy, a lot of your work is on a golf course, right?
A lot.
And none of my work is done on a golf course.
It's the only way I'd have
I
it.
aspire to that someday. Yeah, for sure. Like you're way smarter than me. You planned ahead. I didn't plan ahead when I was giving up my 20s and 30s to do this job. I never thought, wow, I can't do this from a golf course.
Yeah, just so you know, I'm going to help out with your podcast starting next week because I feel like
Anytime.
I'm the smartest guy in this room.
come on.
So
His podcast is done from like Lone Star. He's always telling me, hey, I'm playing golf with this famous, like he's always playing golf with ex-Cowboys and stuff. And he's like, guess who I'm playing golf with? And I'm like, man, I want to be you when I grow up.
Yeah, right. All right, so let's talk about your shoulder.
Okay.
So walk us through this. How did the injury happen, and at what point? Because a lot of guys, and I'm not one of them, clearly, right? But you walk around and you're the walking wounded forever. So walk us through that whole process.
Yeah. So, I mean, it took a long time to get to where it got. Probably lifting weights and playing football was most of it. And then just getting older and continuing to lift weights really put a lot of wear and tear on it. That started to slow down. I started doing just natural body, pull-ups, push-ups, things like that. But it started to get a really bad sting in it when I was going on my backswing, to the point where I was dealing with it, but then it started to actually slip out of socket on backswings, and I was like, okay, now it's got to get
That's
fixed.
a little awkward on the course.
I mean, it was hanging on by a thread.
It certainly impairs your golf
yeah.
game. I think the only reason, honestly, we'll be completely honest with you, I think the only reason Andrew finally decided to have his shoulder fixed is because it was limiting. His scores were going up.
I couldn't swing correctly.
So
not at all.
When you're used to playing golf and you're really good at it, and all of a sudden you're adding strokes to your game because you can't pull the club back, that's the only time you really end up seeing a surgeon. The not sleeping at night, the waking up every time you roll over, he was fine with.
I've got another shoulder.
It's the backswing, yeah.
It was honestly the breaking point, especially when it started to just completely slip out. So you can speak to this better than I can, but I came in, it was frozen.
I think it was one of those back fence kind of consultations, I think, initially, right? And so like, did you need an MR? This has been going on for a long time. And the fact that he had another shoulder. So the problem with a lot of the average age of rotator cuff tear is in the mid-50s in the US, because the tissue has to dry out and tear before it usually gets bad, unless you're an athlete and you tear it with sports. But there's a disease called outlet obstruction where you have what's called a type 2 acromion, or a little bit of an anterior hook. It's less than 15% of the population, but it's about 85% of the people that tear a cuff in their 50s, because there's just not enough room as you get older. And if you think of a new rope and then a 50-year-old rope that's left in the barn for 50 years in Texas, it's all dried out, it gets thicker, it's easier to get a fray. And that's kind of the beginning of rotator cuff disease and dysfunction. So Andrew obviously had already had the other side done, because you have that little hook, and eventually the other side's going to go too if you're still doing a lot of overhead stuff. And for Andrew, the impingement, the cuff tear, and then just riding it out, he got to the point where he had secondary instability, a big labral tear, a lot of loose junk floating around his shoulder, some early degenerative changes. So we talk about how there is the reason a lot of people see me as wanting that magic shot. But there are certainly times where I have to at least set you up for success a little bit for the magic shot. And so Andrew's one of those patients that needed kind of both sides of me, the traditional orthopedic surgeon, like, I got to sew some of this back together, get rid of all the loose junk, or there's not really, the first question for Andrew was, can't you just put cells in it and this go away? Like, sure, like 20 years ago, right?
Yeah.
But when your shoulder's not even staying stable, we had to fix some things. And then once you fix it, and we make that joke all the time, I didn't fix it. I put it in a position where you have the opportunity to heal, but we still got to get you to heal. And so that's where the use of your bone marrow at the time of surgery is something I've done on every shoulder for more than the last decade. And it makes a tremendous difference in overall healing, decrease your risk of infection to about zero.
Well, can you tell us the results of that too, about how that looked after the surgery? And
he has that, and he has something to compare it to, that he was 20 years younger when he had it done too, right?
So the most amazing thing was when I was 28, I had this one I had a torn labrum here and rotator cuff, had it redone. It took months and months to get to a point where I could even entertain going out on a golf course. And if I did, it was maybe some light chipping and some putting, but there was still a lot of pain there. Couldn't lift above my head. So that was in the back of my mind. That's one of the reasons I put it off for so long. I was like, I don't want to do this again. But in speaking with Wade, we went through the procedure, and after 2 weeks, I was already moving around. Like you said, I was sending you pictures of me fishing.
Oh yeah, that's the biggest panic is because Andrew,
two and a half weeks.
He literally sends me pictures of him fishing with this holding up this big fish. And I was like,
maybe you shouldn't be.
Is that the shoulder I did? Yeah. It's like, are you okay? He goes, dude, it doesn't hurt. I'm doing this and this. I'm like, okay. Yeah.
So then after about 3.5 weeks, it was extremely comfortable. I was taking the arm brace off, moving it around. Rehab started, and then I was invited to play in a golf tournament.
How far out?
That was 6.5 weeks out, and I wasn't sure if I was going to make it. I'd started rehab, but after the first week of rehab, I was, from what I felt, I was 85 to 90% recovered. So sure enough, I go out there
without calling and asking me.
You're correct.
Most important part, it wasn't like, "Hey, McKenna,
There's
is
only like
it
yes to
okay
call
if I do this?"
You can just shout
No.
over the fence.
Yeah.
So the next thing I sent him was a picture of the award of closest to pin.
Yeah.
And then I also got longest drive.
Yeah. So longest drive 6 weeks after shoulder surgery. I was totally thrilled about it.
Wow.
And I'm thinking, I'm 43 now. I did this one when I was 28. This is going to be twice as long as the recovery time. It's going to hurt twice as much. It didn't. I was off of pain medication in 2 weeks. There was some hiccups after that point.
From
Had
an
a little
increased
bit
activity
more.
level above what maybe the surgeon would have selected for you.
It was absolutely remarkable with the umbilical cord right
So
laying on there.
so I
and
used
then also
a
shells.
patch from amnion and took your bone marrow
Yes.
and put it in the cells. That's the biggest thing that most people are afraid of. And I think that we talked.
Yeah.
I think you too, right?
A lot of people
was
told me how much that hurt.
The
and
bone
it
marrow part
I
scares
couldn't
everyone
feel
to
a
death.
thing from that. Never once did I feel a
It's
thing.
not uncommon that when, and we're going to bring Ashley up again because now I'm determined to mention her name in every episode.
Shout
When
out
Ashley
Ashley.
takes people's, and really with shoulder, I don't even think we use suture most of the time. It's just this pernio. I do a subQ closure. But there's always one stitch in the bone marrow harvest site because I've played with every other way to close that I can think of, and nothing ever gives you as good a result as quickly and as easy as just putting one stitch in. So there's still one stitch to take out. And I can't get away from it. I've tried everything. I've done glue, we've done, but everything is, because it's right on the belt line, it's just more of a problem, and I don't want it to be an issue. So just stay with that one stitch.
single stitch.
One single stitch. But Ashley will have to remind people. And when people come in at the 2 week mark to get all the stitches out, and she'll be like, "Hey, what about the one in your hip?" And people are like, "Oh, I forgot." So it's not like it does. From a pain perspective, you're not. Most people forget about it, right?
Yeah, no, I absolutely forgot about it. And I had spoken to people that had some marrow pulled from their hip, and they said that was the most painful part.
Yeah.
I couldn't walk for a week or so. I never felt a thing.
That was, one of the, God, if it was still such a big deal to get marrow, we would only be still using it for cancer patients. Right. Yeah. So one of the first things we had to do is develop a system that allowed us easy access to the best cell you have. Even though your stem cells aren't always the best, it's still the best one you have. It's the one doing all the work for you.
Right.
And so to be able to develop an easy way of access to that really doesn't slow down, change the surgery much, but definitely augments a patient's response, lowers your infection rate. And from a healing perspective, puts you on a much more predictable pathway to actually being able to heal up what I sewed together. I think that the initial fear from a patient is, well, I want you to fix my cup, but I don't know about the whole bone marrow thing. And I'm like, trust me, this is the least invasive thing I can do to tilt the scale in your favor. And I think that when you talk to a patient about it, everyone's like, oh, I would do that again. I didn't even notice it. But boy, when people talk about it, there's all these horror stories out there.
Yep.
And it's really, once you go through it once, you're like, oh, like not a big deal. For sure.
No, the rehab was incredibly smooth. In fact, the guy I was working with was like, maybe don't push it so hard. I'm like, it doesn't hurt. He goes, yeah, but just because it feels so good, don't push it too much. So.
That's what most therapists, and here's the reason for that, right? Because they're afraid that if you tear something up, the orthopedic surgeon, because most orthopedic surgeons, they're going to throw a rock. Well, if you wouldn't have done the therapy, that the therapist would tore your shoulder. No, that's just not true, right? Like that cuff isn't really healed until you're 3 to 6 months out. But my repair should hold through that. If that repair doesn't hold through the first 8, 12 weeks of getting your motion back, it was the repair's fault, not the patient's fault, right? So I tell people all the time, like, I want a therapist that's going to be really aggressive getting your restoration of function. I don't want you doing a lot of strength stuff. I may not want you swinging a golf club right away, but it's not going to hurt anything we did. Right. You just may have to hurt and swell a little longer than you would have if you didn't do so much so fast. But is it going to make the cells not work? No. Is it going to make your cuff fail faster? No. We're probably still not being aggressive enough because we've redone 2 cuffs in the last 10 years, and both of them had a significant amount of trauma really early on to mess it up. So it's not that the repair is going to fail if the therapist is too aggressive. So I have to literally almost counsel therapists on the phone. I want overhead range, but Dr. McKenna, I'm not used to get them on a wall pulley, get their arm above their head, right? And Andrew's like, are you sure I can do all this? I'm like, dude, get your arm above your head, right? The minute you get your arm above your head, your pain's going to go away.
Yeah, and it did. And I also remember at 8 weeks, which you brought up, I dove into the neighbor across from us pool where he said it was deeper than it was, and my arm was bent back. And that's when I came back to see you, and I'm like, I don't know if I popped something or whatever, but...
my first question was, what were you doing? He's like,
that was my favorite part. I'm like, back again? So sick.
Well, your first question was, which neighbor is that?
Because I had no idea. Like, I don't even know who in my neighborhood has a pool, right? So Andrew's swimming at everyone's houses. So
I network. That's what I do.
Yeah.
It's awesome, man.
So, but yeah, that just ended up being a little... probably inflammation or something, and it was fine.
No, you did tweak it a little bit. Got a little bit of range of motion. You know what? It would have, had you not gotten that, it would have taken longer to get your motion back. You kind of did your own manipulation.
I guess so.
So, but that's fine. Like you're not going to tear the cuff doing that.
Well, and just for perspective, right? And coming up, mid 2005, 2010s when I started in orthopedics and helping out in the OR. The standard of care was shoulder immobilizer after a rotator cuff surgery for what, 6 to 8 weeks.
Probably one of the most controversial things we do is get people out of the sling. Even the next night, you take the sling off, start eating, start hanging arm exercises. And Andrew's like, "Are you sure?" I'm like, "Am I sure? Yeah, I'm pretty sure. Yeah, you can take that off and start doing stuff."
So we talk about the risk to the therapist, right? The therapist is afraid to do
therapists are all
things.
panicked. Mike's, in all full disclosure, Mike's wife is an amazing physical therapist that specializes in really difficult handicapped kids and stuff. So Mike's wife is the model of physical therapists and how anal they can be. Yeah, for sure. About how anal they can be about not hurting someone. But I literally almost have to put them in counseling to say, it's okay.
Yeah.
Because they're worried that if they tear it up, I'm going to throw a stone. That's not my job. Is if they tear it up, we need to do something a little bit different because they need to be able to get range of motion back as fast as humanly possible so they don't lose strength and get a lot of atrophy. Most of the time, by the time we take care of someone, you've already had a year or two of functional activity changes and you're already getting a little weak.
Sure.
I got to get you where you were 2 or 3 years ago, not where you were the day before I did your surgery.
Yep.
Right. So my goal is the faster I can get you strength and range of motion, the better you're going to do.
All right, so not that I want to balloon his ego or give him too much credit right now, but how's your drive, right? Like, I'm not a golfer, so I that's the one term I know to ask you to sound like I'm relevant. But are you driving farther? Is it about the same? Where are we at?
I'm not driving where I was when I was, my 20s.
Well, no, that's not. Now, if that happened, we'd have a lot more patients coming in. Just make my game tighter. Right?
Yeah,
on a good day, on a good hit, I can still get it close to 300.
Man, that's awesome.
But that's
well,
not,
he did win longest drive at the 6.5 week mark after surgery on a charity tournament where there's not, the guys playing in the charity tournament.
A 1 in 20 shot. I mean, I was very lucky to hit that one.
And you played that up in the golf cart the whole way, right? You're looking at your partners going, guys, I've been dealing with a recovering surgery. I just don't feel like I'm going to be there. I need a higher handicap for the day.
Hey, off the record, theoretically, there may be a lot of money changing hands at some of these golf tournaments. and these guys have to add a little extra element of something to keep them interested a lot of times. And Andrew, can walk out saying, "I just had shoulder surgery." Everyone's like, "So we're playing strokes, right? Like, how much are we playing on?" Like,
He's still wearing the sling
everything.
while he's doing
He'll wear
it.
the sling out to the golf course, and they're playing big money skins games. Andrew's like taking off his sling, limping up to there, and driving
Showing him
300 yards
scar.
down the
Yeah,
middle.
I
Yeah,
know.
look at my scar. I just had shoulder surgery.
I even have one on my hip.
We're playing skins, right, Andrew? Andrew's like, "Oh, I don't know if you guys want to. If it's the only way to keep you interested."
No, there was no money exchange that day. It was a charity golf tournament.
There's
but-
never money exchange.
Never
No,
money
never,
exchange.
no.
So we want to
No
make
one
that
plays
clear.
golf
Things
like
on.
that.
That's right.
And there's absolutely no alcohol consumed on a golf course.
I've seen a lot of TV
I didn't
shows.
say
where they do
that. I did not say that. That's swing lube. You gotta have some of
A
that.
little swing loop at 60. I don't even know. It's been so long since I've swung a club. I don't even know. I mean, that's not true. I play top golf with kids. Does that count? My 10-year-old's dead eye with a 6-iron
that's awesome.
at top golf. So
Yeah,
Man,
But most importantly, is it pain-free when you play?
absolutely.
And then I have to say, as long as you're
It's-
enjoying it
it's
pain-free, that's everyone's usual top goal. Is I just want to do things I enjoy pain-free.
Not only is it pain-free, but I've always been. I'm right-handed, and my right. So this is my throwing arm. It was always stronger. I would say that my left shoulder is not significantly, but considerably stronger and more solid
same thing
than
with Preston.
this right shoulder from when it was repaired when I was younger.
you just feel more like sturdy strength.
Yeah, there's
like,
3
you
or
can rely
4
on this one more than you can.
There's
this
3 or
one.
4 really good clicks and pops that still happen in this one, whereas there's sometimes maybe one in this one. Now, when I was rehabbing, there was plenty, but once they got it up over my
once
head,
you get your motion,
and stretched it, it's fine now.
it's amazing
Wow.
what that. So when you get more proprioceptive neurogenic intervention, which is what the cells are stimulating, is angiogenesis, or the return of new blood supply. And so a lot of the capsule of the shoulder is where your sense of the sixth sense is proprioception. So your sense of kind of where your shoulder is in space, so that when you're in a certain level, the amount of pain resistance. So that feeling of strength returning when you put cells in someone's shoulder and they get proprioceptive return of capsular strength. That's even with Preston, he said it felt very quickly like the shoulder he did surgery on was stronger than my other side, because you're feeling it more, right? Your body isn't starting to turn that off because it's so chronically inflamed that you don't have the same sense of where it is, and the same sense of stable and strength is limited by an inflammatory response from a chronic injury. When you get rid of that chronic injury, that inflammatory response still doesn't go away because it's all scarred in. If you use cells and restoration of healing, and you get angiogenesis, you do get that sense of where your shoulder is in space again, and it does feel less inflamed and stronger for people. Even if you just did an independent measurement of strength, it's probably not any better than it was the year before, but it's dramatically the amount of where you can feel where it is, and your body's resistance to let you do stuff goes away if it is less inflamed and healed and healthier. And that's the reason for that. And I'm more and more convinced that that's where people's overall sense of wellness comes from, is your inflammatory load. And is it scarred in or is it healed? And if you can feel where it's at in space more, it feels stronger and more stable. And I think that's one of the things that I can't make the body do that, but I can make it easier for your body to be able to do that.
And what is that word again?
Proprioception. So your sense of where
Proprioception.
so if you replace someone's shoulder, it's very difficult for them to close their eyes and touch their nose. They have to kind of look at where it is and guide it in. So when you're doing something that's inflamed and hurts, you'll find people kind of move around that a little bit, so the shoulder's never in the position they want because it doesn't feel right. And after an ACL surgery, that sense of the hamstring and quad being able to kick in right. So when you inject graft in the ACL, the reason their survivorship is so much higher than ACLs done without cells, the reason is not just the healing, right? 179 days compared to 369 is what's published. Who would ever do an ACL reconstruction without marrow? But more importantly, the re-tear rate and the sense of stability in someone's knee is because the capsular strength, your ability to, like when you go to walk and lift up and go upstairs and rocks and stuff, you're not saying, okay, my hamstring needs to engage a little bit. Now my quad needs to engage. Now my hamstring needs to let loose. Now there's a screw home mechanism knee. So now it's not a conscious thing. It's a subconscious effort. But that subconscious effort, your body's proprioceptive feedback to your brain has less data sets coming in. So it does a poor job. The more data sets you get, the more capsular wellness, the better blood supply to the tendons, the better strength around the more proprioceptive fibers become subconscious thought and learned behavior again, and the better people do. And it's just because we're doing surgery, not making it well, but when you said it makes it well. It makes total sense when you understand that what we're trying to do is just make the joint function like it used to. Your body turns a lot of that off normally as you get older, because if it really hurt bad every time you put your knee on the ground, but there's a reason things kind of get stiff and you change your gait and you shuffle a little bit as you get older, because the human body is just trying to maintain bipedal motion. Like as long as you can walk, the body's good. Like a lot of energy is expended to just help you do that. The reason we put cells where we do is to get that restoration of proprioception, so your body's not getting in its own way so much.
I remember I was naturally kind of using my trap and holding my shoulder up. And when I was going to rehab, they would make sure that my arm was extended all the way down when I lifted up, because I was doing this.
Otherwise, you raise your scapula to do it.
I was doing that and avoiding the healing or it was stretching.
You can get deltoid strength, but what happens is the scapula starts moving with the humerus.
Yes.
And so people go, oh, I get my arm up, but they're moving their whole shoulder blade. That's not glenohumeral motion. Like if you keep the scapula down and get your shoulder moving, that's restoration of function.
Yep.
Like getting your arm up, it depends on how much your scapula is moving, how much your trap kicking in. Are we still getting your pec? There's a lot more involved in that than just, can you get your arm up?
Yep.
And we want you getting your arm up normally with restoration of normal motion, so your body cannot be inflamed every time you do it.
Yep. And I was doing it completely subconsciously.
Yeah, the wrong muscles.
I would look in the mirror and I'd be like this.
Yeah, for sure.
Yeah, and it was just...
That's the body's way of trying to compensate, right? Everything has a compensatory mechanism to make it function more normal in the face of injury. That's why we can wait so long to treat stuff.
Yeah.
Right? Is the body there's always this was designed to stay functional even as you get old and injured. It's just harder and harder for it to do it on its own, right? We will adapt. But I want you to not have to adapt.
Yeah.
Right. I want to restore it to where it works like it's supposed to. Not where, like when I was a kid, I would wrap clothes hangers on a bumper to keep it up. Right? Because I'm adapting. The car needed a bumper. The human body does that too. It'll put it together with tape and duct tape and wire if it has to, but it's not it's not pain-free. It's not without inflammation.
Comes with risks.
Yeah. And you're always at risk of injuring it easier every time.
Yeah.
The more injured you are, the easier it is to hurt yourself, right?
So is that why you're, I don't want to use the term, but I'm going to, aggressive? You're more aggressive in post-op therapy, in not putting them in a shoulder immobilizer for 6 to 8 weeks, and getting with the therapist, retraining how they're going to treat or making suggestions.
I don't want your body to unlearn everything it's worked its whole life to learn.
Yeah.
The faster I get you doing stuff, the more natural that will become. If I let you unlearn it and be atrophic and disuse atrophy is real, we see it every week. Someone will be in a cast or a big immobilizer, and the first thing I do is take it off.
Yeah.
With Preston, he told the story. They literally put him in a cast. I said, get in here and cut that off, right? They're like, don't I need the cast? Do you want it to be smaller and stiffer and not work as well when we take it off? Because that's the only thing that's going to do.
I mean, just like my friend who came and saw him this week, who, pulled just the wrong weight down on the wrong angle and got some bursitis there, and she went to the ER that night, and they
mobilizer, don't move it.
He said, stay in that sling for the next 2 weeks.
Well, that's the standard of care.
And I'm like, I think we should get out of it, maybe start mobilizing a bit.
Maybe we need to do some hanging arm exercises so you can get rid of some of the swelling, get better blood flow.
Allowing it to get used to right there. I'm like, it's getting stiff, stay in one place. And
it's a low grade fire that your body can't put out. Right. If I can get you moving, the body can get new blood supply. New blood has to get where it needs to go to help you heal. If everything's swollen and inflamed, the glass is already full. Like you can't put something new in it, right? So motion helps kind of restore the balance, right?
So every once in a while, I like to kind of poke the bear a little bit and get him on a topic, because I like the passion that he shows. And it's listen, we've been friends a long time. We've always worked together in many different capacities over the years. So I like to look at him and go, well, that's not the standard of care. That's not, you're supposed to keep that immobilized for 6 weeks. So I'll tell you that to tell you this. Last weekend, I got a chance to go to Colorado and do some hiking. And while we're out, I see two guys jump off the edge of a mountain with those little paraglider deals. And in my head, the only thought I had was, who's the first guy to think that was a good idea and do it? Right? Who's the first guy that thought, I'm going to take this piece of fabric, hold 2 strings, and jump off this mountain, perfectly good mountain, right? And hope that this thing can keep me afloat long enough to not let gravity kill me. So professionally speaking, I look at some of the things he does, and it's not that he takes extreme risks or anything like that.
But I ain't afraid.
I look at, exactly.
I'm not afraid to let the body do what it's designed to do, right?
Right.
We understand physiology and science better than most, or at least as well as any traditional Western medicine surgeon's going to. And if I can help you optimize and get through that, sometimes testing the boundaries a little bit is the real way to advance the science, right?
Yeah.
If no one steps out, everyone's still doing it the same way forever. iPhone wouldn't be invented. We wouldn't be, I mean, come on, like someone had to take a chance, right?
One of the jobs I had in college, I was an independent contractor, Virginia Tech, go Hokies. And I worked for a company called Orthopedic, I believe it was. And they had,
very familiar.
okay, so they had after you had like an ACL or something, you would lay your leg in it and it would move your leg for you.
CPM machine.
And I would, and I would say, well, why don't you want to ice that and keep it still? But I spoke with a doctor. He goes, you got to get that blood in there. You got to get it moving. That's how it gets healed.
And
so that all makes sense to me.
That was such a great idea. The CPM, a continued passive motion machine. And after a total knee, we'd put people on CPMs in the hospital. They have less swelling. Guess what's not covered by insurance and even done anymore? CPMs in the hospital.
And they're impossible.
Medicare doesn't even cover it now. It used to be part of the procedure. Now the hospitals. So we've gone backwards. So that's one of those things that you think, that's a great idea. Sure is. Sure is. It's a great
Didn't
idea.
last very
and it
long.
makes total sense if you really want to talk about how to heal. Guess what's not covered by insurance and not even used anymore because it's too expensive and Medicare doesn't cover it after a total knee. People that I did total knees on back in the day, I'll go, hey, when you're doing their other side 10 years later, are you going to put me in that thing again? And the CPM, like, where? I'm like, nope, Medicare doesn't allow us to do it anymore and the hospitals don't cover it and no hospital even has them because it's not. So we've go Western, again, this is on the whole science. Some things in Western medicine are only done because it has a code and it's compensable, not because it's right. And if it was just about doing the right thing to help patients get better faster, this is way more fun.
Yeah.
But if it's about what's compensable, has a code, things aren't always working to the best for the patient. That's a great example.
Yeah.
Because you're exactly right. It's such a great idea. Wow, we should do that on everyone. That was 20 years ago and it was covered and compensable and now it's not. And the only reason is because insurance didn't like paying for it.
Yeah, and I think that's a big part of the reason why we wanted you on the show today is you're the goal, right, for our patients. There's tons of patients out there that have shoulder pain. They're walking around, the walking wounded, right? We're all trying to make up for things and coat hanger the bumper back on the car.
Right.
But the aggressive rehab, the aggressive therapy protocols, the hey, let's get you moving as normal as possible right away. And so that's really, we wanted to hear your story. We think a lot of people are gonna kind of feel that same thing as they're listening and go, man, I get that. I had to keep my arm still for a long time. I'm literally in photos, I look different one side of my body to the other because I've atrophied that much.
I had not done a lot of research with the stem cell and the amniotic.
The amniotic. We
fancy
use a
words.
patch
Tissue
made from
graft.
postnatal
There's-
tissue graft.
But
Appreciate you for trying.
once
We like to
I
be specific.
experienced it
Yeah.
and being able to have something I could compare it to, absolutely bought in, incredibly grateful. I would do this 10 times if you asked me to.
Oh, dude, I genuinely appreciate. Honestly, the best thing that can happen for me is, and I know we talk about how I'm an acquired taste for sure, but and especially as a neighbor, because
neighbor I got.
it's like I'm pretty low maintenance, but Andrew's literally the one that'll come and say, help me take my trees up and make sure that my grass isn't dead. But I know that from that, but the biggest compliment for me is when friends, family, neighbors, family of other patients allow me to participate in their care, because that means more to me than being the guy that he's so kind. I genuinely think I'm kind and sweet too. But I know that from a science perspective or a medical perspective, that I'm kind of the idiot savant. Like I know nothing about 99% of the world, but I know a lot about this much. And so I just want people to let me use my skills on that much of them. And I genuinely appreciate the trust that you've shown in our clinic and in me.
Well, you have a happy customer. Trust me.
Thank you very much.
Yep.
All right, guys. Well, we're signing off now. This amazing episode. Thank you, Andrew, for joining us. And
My pleasure.
we'll
100%.
see you guys next time.
And again, I know we talk about this every time, but it's just as true now as it was 9 episodes ago, maybe. I don't even know. But we genuinely appreciate your trust. Thank you for letting us participate in your day and whenever you chose to watch or listen to this. And please continue to like, subscribe, and comment, and let us know kind of what direction or any subject or topics you want us to cover. Thank you again.